All right, good morning, everyone, and thank you for tuning in this morning to Health Talk. I'm Dr. Victor Politi, President and CEO of New Health, Nassau University Medical Center. So, as healthcare in America is changing, New Health, NUMC, is part of that change. So, this half-hour program will provide you with the essential information about our lifestyle, our services, top-quality healthcare that is here for you. New Health's roots go deep into Long Island's history. What began in 1935 as a 200-bed general hospital has now become a unique health organization with multiple centers of care and a commitment to deliver essential care to everyone at every stage of life. You already know us as Nassau County's premier Level 1 trauma center. We have so much more to offer the community, including a full-service, state-of-the-art New Health Center of Care in Nassau County, the A. Holly Patterson Extended Care Facility in East Meadow, in Uniondale, and New Health Family Health Centers, the FQHCs, across Long Island. So our improvements are making us a leader and a primary provider of tertiary care services that rival the best in the country. So today we have a great talk, a great show with Dr. Charles Ruotolo, who is our Director and Chairman of Orthopedic Medicine at Nassau University Medical Center. So as you know, Nassau University Medical Center is a Level 1 trauma center. We see a lot of car accidents. We see a lot of trauma, but we're so much more than that. We have great cardiology facilities. We are the stroke center. We receive, A in patient safety as far as different types of IV lines and Foley catheters, things that we don't have any infections. We really receive great awards. We received an A in gynecological surgery, 5 stars, 3 years in a row. And hopefully this year will be our 4th year in a row, the only hospital to receive such high honors. So the hospital is really a great place to receive health care. But when we talk about our trauma, we talk about car accidents, motorcycle accidents, falls. We see a lot of orthopedic injuries, a lot of fractured bones, a lot of spinal trauma. We also see a lot of different types of injuries that really need special care. And one of the groups of physicians that we are most proud of in the hospital, that we really feel are really one of the best groups in Long Island, if not the entire area, is the Total Orthopedic group. Total Orthopedics is a private physicians group of orthopedic surgeons that are basically in the hospital. They have a floor in the hospital, they have their private offices in the hospital, and they're available 24/7 to us in the emergency department or in that hospital if any type of trauma comes in or any type of emergency fractures, whether it's your leg, your arm, or God forbid your spine. These guys are the pros. So Dr. Charles Ruotolo is here with us today. He's the chairman, director of the Total Orthopedics and the chairman of orthopedics for our hospital. So good morning, Charles, and welcome. Thank you for coming to Health Talk this morning.
Thank you, Dr. Politi. Thank you for having me here today.
So why don't you start off by telling us about yourself, where you went to medical school, and what you're doing here at Nassau University Medical Center.
So I'm an orthopedic surgeon who specializes in sports medicine. I went to New York Medical College for my medical school, and then from there I trained at Stony Brook for orthopedics, which is a 5-year program, and after that I did a 1-year fellowship in sports medicine out in Laguna Hills, California. Since then I've been practicing at Nassau University Medical Center. Nassau University Medical Center was a place that I rotated at as a resident at Stony Brook, and I loved it. I thought it was a very dynamic place, very exciting. And in orthopedics, we did some of the cutting-edge stuff in my training, and I was very happy to come back there.
Well, we really are really great that you did come back. And, Charles, as a physician myself, as an ER doc, I see a lot of orthopedic doctors. I see a lot of injuries. And I can honestly say in my heart, and to all my listeners, that, I have such confidence in what you do that, God forbid, something happens to a member of my family or someone should call me up about any type of orthopedic procedure, I would have absolutely no problem referring them to you. I really feel that strong about the program.
Well, that's very nice of you to say.
Yeah.
We have a large group of orthopedic surgeons at Total Orthopedics and at Nassau University Medical Center. All of us are fellowship trained in the different specialties in orthopedics, including sports medicine, hand surgery, spine surgery, orthopedic traumatology. We have a foot and ankle specialist as well. So we provide the full gamut for services at Nassau University Medical Center.
Yeah, and truthfully, as the CEO, a lot of people call me up and say, "Oh, Dr. Politi, I need a referral," and I do refer a lot of people to you. And that's tough because once you refer someone, if they don't get if they're not completely satisfied with their care, you hear it every time you see them, or every time you talk to them, they'll be talking about it. So, and I have to honestly say, every one of them have been really pleased with the work that they do. So, Total Orthopedic is a private group. You have other locations throughout Nassau County?
Yes, we have an office in Massapequa. We also have an office in Wantagh. We recently opened up an office in Deer Park, and so and we also see some patients in the Bronx and in Union Square in Manhattan.
You're just about all over the place, yeah. Well, that's great. But that's what brings you to a different level. You're not just hospital-employed orthopedic physicians. You're a businessman. You're out there in the community. You're providing a service. It just as anyone would want, a private physician. And now you're bringing that private physician practice to the hospital. You're bringing that concierge medicine, that very individualized medicine that patients really want. They don't want to go to a hospital and see a clinic physician. They want to go to the hospital and see their doctor. They want to see a world-renowned orthopedic surgeon that's going to take care of them. And that's what you get at Nassau University Medical Center. And before, I've only been in the hospital in NUMC for about a year now, and I have no idea that the hospital had these types of services, such as yours in orthopedics, or Dr. Fontana in neurosurgery, Harvard trained, Columbia, Swiss Institute for Spine, and she's in that building as well, or the cardiology programs that we have there. I mean, I had no idea the services provided in Nassau University Medical Center, and you epitomize that type of a service, really, the level of care that you provide. So it's a trauma center. So do you have physicians available 24/7 to come to the aid of patients that we have in the emergency department?
Certainly, we have. There's an orthopedist on call that's ready to take care of anything that comes into Nassau University Medical Center 24 hours a day. We have 2 orthopedic traumatologists on staff who are fellowship trained in orthopedic trauma and really just specialize in taking care of fractures. Certainly, not every single trauma that comes in has a specialized fracture, and some people have ligament injuries, which would be more of a sports medicine problem. But for the people that have those serious pelvis injuries or injuries of their hip socket that need an orthopedic traumatologist who's trained just in doing fractures, we certainly have one always available.
So I know you're a sports medicine, and in Nassau County, every parent that's listening to the show is probably like myself, and we run from soccer game to lacrosse game to basketball to softball. The kids are active out here. I mean, they're always playing sports. They're always involved in something. If not, they're riding a bicycle up through the Bethpage bicycle path and off-roading it and injuring their shoulders. So what types of sports injuries do you see, and what sort of injuries do you specialize in?
So I specialize mostly in shoulders and knee surgery. In particular, in shoulders, it's really rotator cuff repairs and surgery for shoulder dislocations. And then knees, knees can be a lot of different things, but the one thing I think I do an excellent job in is anterior cruciate ligament reconstructions.
Mm-hmm. Well, it's good to know. I love to ski, and I do a lot of skiing every year, and I'm getting old, and I'm sort of out of shape. And now my knees are, after a couple of runs, my knees are screaming, so I have to come take a look at it and see what you can do. Maybe tighten up the rubber bands in there or something,
Yeah, one of the things that we've changed recently at NUMC is we do an all-inside anterior cruciate ligament reconstruction, which is this newer technique. And the nice thing about it is when you do an ACL reconstruction, you have to take a graft from somewhere else, and so when you take a graft, you can take a graft from yourself or a donated graft, and it's been shown taking a graft from yourself is much stronger than a donated graft and has less of a failure rate down the line. Sometimes the donated grafts will fail as time goes on. And then as far as taking a graft from yourself, I do this new technique where you take a hamstring graft, but in the past we used to have to take 2 hamstring grafts. Instead I take one, I fold it in fourths, which is this newer technique that's only been around for the last 2 years. And that way you have more hamstring strength afterwards. It's less pain. And then I do this technique where I actually don't drill holes all the way out of the bone the way we used to do it, which also has less pain. So the patients have a stronger graft, have less post-operative pain, and also progress a little bit faster than they used to. So that's one of the things that we now do at NUMC. I do that. Dr. McCormick, who's our other sports medicine doctor, does that same procedure that we have for our patients that is really state-of-the-art.
That's great. So here we are. I'm listening to the show. I'm driving, but I have all aches and pains, my knees, my shoulders. Sometimes it locks up on me. What should I do? Should I make an appointment to come see you guys? Should I go to an internist first to get him to look at it? And what would be the procedure there for the MRI, or how do you do that?
Well, certainly, if you're having shoulder pain and it's been bothering you, you should come see an orthopedic surgeon. You should see someone who specializes in that, and you can call us. We have an 800 number, so you can reach us at any of our locations from one number, which is 1-855-321-ORTHO. And so from there, you should see the orthopedist. The orthopedist, like myself, would evaluate you, see what's going on with your shoulder. And some shoulder things are minor things and don't need much, and some shoulder things are a little bit more of a problem and need some physical therapy. Certainly some of them will need an MRI to see what the soft tissue injury is and whether you have just some tendinitis of your rotator cuff tendon, or maybe you have something more serious like a rotator cuff tear. And usually if you're young and healthy, meaning under the age of 70, and you have a rotator cuff tear, that's a surgical problem.
Mm-hmm.
And because rotator cuff tears, as time goes on, tend to get bigger and tend to get worse and can become big problems if not treated appropriately.
Mm-hmm. So not every ache and pain requires surgery, right? So if we come to see, people say orthopedic surgeon, well, it may just be a sprain. I may not need to see an orthopedic doctor. I can see a chiropractor, or I can see an internist. But we could actually make appointments. It wasn't about 321.
So it's 855-321-ORTHO, ORTHO.
Oh, so I can call that number. I don't need to see my primary care physician first?
And so I think this is why you want to go to an orthopedist, because you want to know specifically, is this something that's minor? Is this something that's more severe? Is this something, and I think at Total Orthopedics we do a very good job of teaching the patients that come in what their problem is, what their different options are, and what the success rate from all those different options are. And I think we pride ourselves in spending a little bit extra time with patients, really explaining what their problem is, and we're not surgery happy docs, and that's some orthopedists have a bad reputation. You go to the orthopedist, and the one thing he says is, well, you need surgery, when would you like it? And we explain what the problems are, go through the different treatment options, and a lot of patients might need just conservative treatment of whether it's an injection or whether it's physical therapy, and sometimes it's just changing your activity pattern. Sometimes you're doing a workout routine and there's one exercise that's aggravating everything and making all your exercise hurt, and that's the big thing. We're sports medicine. Our goal is to get people back playing their sports, doing their activities, staying healthy as soon as possible, and to be happy, and for that to last in the long term.
I mean, it's so important, and the fact that you understand that as an orthopedic surgeon and you do the full level of care really means a lot to patients. I know I do a lot of work with firemen and cops. So as a police surgeon in the past, I deal with a lot of injured cops who, young guys, they don't want to be put off the job. They want to get back to work. They love the job. Firemen especially. Firemen are a special breed of people. They just love that job. They love to get back there. They'll get injured, and they don't care. They want to get back to work. And I know I've referred quite a lot of them over to you, and they speak, very highly of you. And you're able to, either whether make diagnosis through an MRI with some physical therapy, you get these guys back to work, and they're back to work at 100%. And I hear that over and over again from a lot of, especially the NYFD guys, the city firemen. They love those jobs, and they want to get back to work as soon as they can. And the fact that they can go to an orthopedic like yourself and get some really stable treatment for these things, non-invasive treatment, really means a lot to them. So in patients that have surgery or patients that see you, do you work also with National University Medical Center rehab, physical rehab, and occupational medicine?
Certainly. And at NUMC we have a whole team for patients who are having surgery. So coming in, we have specialized anesthesiologists that do very nice ways of numbing up body parts besides going to sleep. So when the patient wakes up, they don't wake up with pain. When they go home, they don't go home with pain. From there, we have a full rehab service, including a rehab department of physiatrists as well as physical therapists that can see and evaluate those patients and treat those patients to get them back to work and get them back to playing their sports.
And it's one of the other shows I had, and if anybody's interested, to go online the NUMC website and look up Dr. Lynn Weiss. And Dr. Lynn Weiss is our chairman of physiatry, or physical medicine and rehabilitation at Nassau University Medical Center. And she's an amazing physiatrist, amazing program. We've received many, many awards for our program in physical medicine rehab. And she has a whole floor in our hospital, really state-of-the-art, modern facility. And she's received the U.S. News and World Report Awards. As a matter of fact, hospitals in Nassau County refer their patients to us for the physical therapy. That's how good it is. So some other hospitals, which I won't name, in the community, great hospitals that do great work, send their patients to Nassau University Medical Center for that physical medicine and rehab, which just speaks to the fact that we have all these services. So here you have a guy comes in, God forbid, injured in the emergency room, gets seen by, top orthopedic guy in the ER, board-certified ER docs. We have the MRIs, the CAT scans. As a matter of fact, we have a 320 slice CT down there, one of the fastest CAT scans in Nassau County. Goes into state-of-the-art operating rooms and up into your service, and eventually winds up in our PM&R for full rehab. So it's sort of the total care picture, sort of the total orthopedic program, I guess, was where you get your name of your company from, which is fantastic.
Yeah, so we have many integrated programs at NUMC, and so for rehab, orthopedics and rehab do a lot of conferences together, so we're all on the same page as far as how we want our patients to be treated. We recently started a co-management program for hip fractures that come in, where the patients that come in with a hip fracture, they're seen by the trauma specialist, the orthopedist, the rehab doctor, and the orthopedic surgeon. We meet daily to go over all those patients, what all their different needs are, because these hip fractures are usually older patients and they need a lot of different services, and they can have medical problems. Certainly they have their orthopedic problem being the fracture, but certainly they have rehabilitation problems, and that way everyone has a dedicated co-management service where everyone's on the same page, and that's been shown in multiple studies to have the best outcomes for those patients.
And so, even though you specialize in shoulders and knees and those things, do you do other surgeries other than just shoulders and knees, or do you?
Yeah, I certainly do for sports medicine. I do a lot of elective elbow surgery, some ankle surgery as well, and I do fractures. In orthopedics, fractures just come with as you're working. I do a lot of, especially in shoulder fractures. I do some minimally invasive surgery for shoulder fractures, and I do shoulder replacements.
So replacements, fantastic. So I mean, they've come a long way in orthopedics, especially with some of the prosthetic devices that are out there now for hips and knees. Where years ago, when they couldn't repair stuff, it was just they'd fuse it and you'd walk with a horrible limp or actually be wheelchair bound. So today, with some of the advances in orthopedic surgery, we're getting people up on their feet. We see miracles occurring in the military, where we such horrific accidents and explosions and injuries from the battlefield, and that the orthopedic surgeons working in the military are coming up with some really amazing types of devices to get people back on their feet. We do any of that type of surgery here? Do we get any of that?
Certainly, one of the exciting things that we do at Nassau too is some of the limb salvage procedures that we do. There's certain patients with traumas where they have bad injuries to their bones. They have fractures where they lose large segments of their bone, just like in the military where you have these IED injuries. And so at Nassau we have one of our orthopedic traumatologists who's trained in bone transport, which is where you make a little fracture in the bone, and using a special device, you slowly transport that bone to fill that defect, and where the fracture is that you make, the new bone grows, and you put them in this device that will slowly grow the bone over time.
Wow.
Which is really kind of a state-of-art thing that NUMC has.
Amazing. Just the advances in medicine are amazing, and the fact that we're staying up on top of this at Nassau University Medical Center and right in the forefront of all this medicine. I mean, you hear a lot, because a lot of hospitals may have a lot of advertising money, and you'll hear them on the radio and on the television talking about their programs, and unfortunately, NUMC, we're put a lot of finances into the programs themselves, and so the word doesn't always get out. So hopefully, shows like this, even though it's on Saturday morning, hopefully people hear it and talk to their friends and neighbors about Total Orthopedic and the fact that there is such a premier group that's right here in East Meadow. That you park right in front of the hospital of Carmen Avenue. You walk inside, you take the elevator, and boom, you got premier orthopedics.
For 2015, I was voted best orthopedic on Long Island by the Long Island Free Press, the best page, best of Long Island.
I was going to mention that, and that is really an amazing award, and really, congratulations. Shelley, did we put anything out on that? I hope we did. Good. That's Shelley Lottberg. She's with our public relations. She's sitting right behind us, cheering us on here. It's amazing. So, other great things. Tell me, now you've taken it to another level. We're having our own orthopedic residency, I believe, starting in July.
Yes.
So why don't you tell me a little bit about what that's about?
So we're starting an orthopedic residency program. That's a 5-year program. I'll be the program director for that. We're very excited because that also adds a certain level of teaching again to our program. And currently, right now, we have orthopedic residents that rotate in from another hospital. And we always enjoy teaching, but having your own residency program also will set up a lot more research that we do, and we're all very excited by the fact that besides the teaching, the level of research that goes with that program. I think all the attendings in the department are excited about the possibilities moving forward with research and really staying at the forefront of medicine.
Yeah, it's a lot of training. The orthopedic surgeons go through a heck of a lot of training, even after their 4 years of college, 4 years of medical school. Then they have to sit there and do 5 years of grueling residency with you guys, and I know you guys put them to work.
Yeah, we kind of pride ourselves on working the rest. It's pretty hard. And I think in orthopedic surgery, you work hard because people don't just fracture their bones at 8 o'clock in the morning. And so you have to be able to be there at 2 a.m., you have to be able to be there at 3 a.m., and when you're there at 2 a.m., you can't tell the 40 patients you see the next day that, I'm sorry, I'm a little tired, and I'm not going to see you today. I know your shoulder hurts, but you'll have to wait till next week. So in orthopedics, every once in a while you have those all-nighters, and I think in your training and everything of just that working hard, I think there's a certain mentality in orthopedics that you kind of put your head to the grindstone, you move through it, and it's just an exciting field by itself. There's no reason to ever be tired when you're doing it.
Yeah. And despite how hard it is, it's one of the most coveted or sought-after residencies there are. I mean, when you look at the hierarchy of residencies, I know the medical students coming out of some of the top medical schools, they want orthopedics. They feel that that's really a rewarding career.
Yes, and orthopedics is always a very competitive program to get into, and part of it's because it's fun. You're talking to people about restoring their function. I spend half the day. I'm either talking about soccer, rugby, football, or lacrosse, which is always fun, and you're talking to people about getting them back. And people come into your office. They're in a lot of pain. They can be frustrated. They can be kind of somewhat depressed from their problem, and you make them better. And it's there's no better feeling than someone kind of skipping out of your office, excited about how they're going to be, whether it's their over 40 lacrosse tournament that they're going to be playing in, or whether it's their 15-year-old going back to soccer. It's a fun occupation.
I have a close friend, also a Nassau County policeman, and he loves golf. I mean, the guy just lives and breathes golf, and he tore his shoulder, and he couldn't play golf. And I know we went to you, and you did some work on him, and the guy's playing a golf game better than he ever did. And so, I mean, during the time that he was sick, it was toe and rotator cuff. He wasn't going to go for surgery. He was trying physical therapy. It just wasn't working, and he just couldn't play golf. And the guy was literally very unhappy because of that. He's one of these guys that's just all his vacations are around golf and all this stuff. He's an older guy. His kids are grown and out of the house, and so I saw such a difference in him. And then after the surgery and some rehabilitation, he's back out there, and he's his old self again. And so I see what you're saying. It really makes a difference.
It's funny what people put up with too, because they'll have a bad shoulder. They'll come in and they'll tell me their shoulder's been hurting for 2 years, and they haven't slept well in 2 years because every time they lay down, their shoulder's killing them.
Yeah.
And they just kind of put it off and put it off. The key things with rotator cuff tears are that rotator cuff tears, if it's a full tear where you actually have a hole in your tendon, it's like a hole in the back of your pants. And if you just try to ignore it and leave it, one day you're going to wake up and that hole is going to be much larger. And the larger your tear is, the more likelihood you have after you sew it back that you re-tear, just kind of like that
Right.
analogy of a tear in your pants. So for people who have rotator cuff tears, they should have that evaluated. They should come into Total Orthopedics. We'll see them, make sure that they don't have a full tear, and if they have a full tear, they need to get it fixed. This is not an emergent problem, and what I tell patients is this is something that you need to have taken care of somewhere in the near future. But whether it's this month or 3 months from now, the key is put the things together in your life that make it so that you can do your rehab, so that you can come out with an excellent result. And so sometimes the golf person will say, okay, I'll wait till November, but which is fine. It certainly works. But certainly rotator cuff tears are not things to kind of just brush off and ignore.
So you think the skiers will come to you now in April and May for their knees, huh?
Yeah, some skiers they do try and put it off, but the problem with skiing is it's usually an ACL tear. You do get some shoulder injuries with skiing, with falling and snowboarding. You see a lot of shoulder dislocations in younger people who are snowboarding, kind of take those tumbles.
Yeah. So we're really excited about the residency. We can't wait to get these guys in there and see some young blood running around. I mean, we at Nassau University Medical Center is a teaching center. It's a university hospital, so we do have residencies in many different programs. And I know the attendings love it because it gives them really a lot of enthusiasm to see the young physicians coming up and learning things, and yet they provide a special care to the patients too. They're young, they're energetic, they take a real special interest in everyone that they see, and it really makes the hospital very well-rounded place, and we love it. Also, we talk about orthopedics and new stuff. We understand you have a whole new 9th floor. A wing of the 9th floor was completely gutted and redone for you guys. Why don't you tell me a little bit about that?
Yeah, so the 9th floor, we have an orthopedic department. It's a wing on the 9th floor. The nice part about it, it's a closed unit, and so it should be a very quiet unit for the patients coming up there. Besides the aesthetic part of it, of being a beautiful brand new floor, coming out of an orthopedic surgery, one of the things, you don't want to hear noise. You don't want to hear hustle and bustle. You want things to be quiet, and we're really excited about this specialty unit just for orthopedics. All the nurses on the orthopedic on the new floor have been in-serviced in the care of orthopedic patients. They're all experienced nurses that we've had in our other orthopedic floors. So I think we kind of give great orthopedic care to the patients that are going to be there. And I have a shoulder replacement today. I'm very excited that he's going to the brand new floor.
Brand new floor.
He should be very happy to be there.
Yeah, I mean, it was great, for us at the hospital to be able to do that, to refurbish that and, put on these really nice fancy glass doors with a nice sign that says Orthopedic and Spine Care Center of Excellence. And, all the rooms are fresh and new painted, and bathrooms and flat screen TV. So it's got all the look. They even took the back wall down so all the sunlight comes in through the nurses' station. It's really a bright and airy place that, hopefully now your patients, like you said, they come in, they get the best ER care, the best operating room, brand new ICU, CCUs if they needed that, and now they go up to a really great area to recover prior to going down to the physical medicine and rehabilitation. So there's so many great things that are happening at Nassau University Medical Center across the board. I mean, I've only been there a year, and I had all my program directors put down a list of things. They came up with 80 pages of improvements to that hospital of this year's, accomplishments for this year of each department. And I was just so proud of all the directors and people that work at that hospital. I mean, the nurses, all the CSEA people are just so hardworking, and I'm really proud to be the CEO there. And then to have a program like yours, Total Orthopedics, in that facility to provide that level of care to the people in Nassau County really gives us a whole new level of care. So, we're looking forward to working with you moving forward, Dr. Ruotolo. And we have so many, different things that are going to come up with you in the future, in the operating room, and new devices and equipment, maybe even a robot in the future. We'll see how that plays out. And it'll just help grow the level of care at Nassau University Medical Center. So we'll be, as good if not better than any of the other hospitals in Nassau County, and that's my hope to go forward. So Dr. Toll, I just want to thank you very, very much for being here today with me. I mean, I really appreciate everything you do. I know the patients and people I referred to you are very, very pleased. So, why don't you say goodbyes and.
Well, thank you, Dr. Politi. It's an honor to be here, and it's an honor to work with you at Nassau University Medical Center. It's the reason why that is our main hospital. It's a wonderful place to be.
Thank you, Charles. So, Dr. Victor Politi, President and CEO of Nassau University Medical Center over there on Hempstead Turnpike, and just wishing everyone a great day and hope you enjoyed the show. Thank you.